the amyloid beta plaques are the target. So these mice were treated with a flicker of 40 hertz. And what they found is that these mice had a reduction in anxiety levels. They improved their memory of places. In other words, they could run through the maze better again and find their cheese. They could recognize objects more easily. They locate objects more easily. There were no adverse effects for several weeks. Rhythmic sensory stimulation, in this case visual stimulation, reduced the amyloid beta most at 40 hertz flicker. This is where there's no light, the black one. And so you have a serious reduction when you stimulate the brain at 40 hertz. And the question is, why are the amyloid levels lower? Well, what happens is that the amyloid is naturally released from neurons. And when there is gamma flicker, microglia are activated and they go and munch up the amyloid beta and clean it up. The microglia are like the little janitors that are supposed to go around and clean up the brain. Pulsation of the light flicker or auditory flicker or vibrotactile flicker activates them. They also saw a significant reduction in the inflammation. There's an increase in immune cells. They saw an increase in the size of blood vessels. And they have since then looked at sound, which is what we were doing, and found that when you combine the two, you have in fact the most potent treatment, but of the two, sound is the more effective.